There are some patients who've been seeing me for so many years. I had a patient who came in NS uniform. And I told him, I said, you are in NS and you want me to give you an MC. I don't know whether they'll recognize it. Hi, I'm Dr. Shermela Appan. I've been a pediatrician since 1981, so that's 40 years. I'm currently attached to StarMed Specialist Center. Seeing children, it's actually not only clinical expertise that's required, but also immense patience. So you can't be doing a rush job. So you'll be missing out a lot of things. Sometimes when you have a crying child, the parent feels guilty that they are unable to calm the child down. So I always tell them, that's not your fault. Doesn't matter. We'll always make do with what we find. Young children, especially those who are under 3, they are unable to communicate. So the pediatrician is trained to get the history, cope with the child who sometimes, of course, when they are sick, they can be crying, they can be uncooperative, and they could be clinging to the mother, have doctor phobia, and so on. So we are able, because that's all in our daily job, is to get over all these problems, examine the child, and come to a certain conclusion, and to give a plan to the parent as to how best to look after. And if need be, we would do investigations. And in StarMed, we've got the lab here, so there's no problem with getting simple investigations done. So when a patient is under a lot of stress and so on, you'll find that the parents, although you talk to them, they don't absorb very much. So when they get back home, they've forgotten half of what you've said. So what I normally do is, after examination, I'll discuss with them. I'll usually give a note as to what the problem is and how to look after the child in a stepwise manner. So when they go home, they still have that piece of paper to look at. It's actually rewarding to see a kid who has doctor phobia. There was a 3-year-old girl who had such severe phobia, she wouldn't even enter the room. She was screaming, clinging on to the mother. The mother said, she was very apologetic, sorry, that she's always had this. So I said, okay, never mind, you can sit outside, calm down. And when she's calmed down, then you bring her in. She was not too bad when she came in. She was still clinging very tight, so I made the most of the situation. But after the 3rd visit, by the 4th visit, she was beginning to say bye when she went out. And subsequently, she came and she hugged me. And, it was such a nice feeling. And the mother was so astounded. She said she normally doesn't do that at all. So that was nice. The other is the fact that my patients have now become parents. And now I'm seeing their kids. So it's like, my service is offered to the next generation. And kids are they are so innocent, spontaneous that, when you see them smile, it's made your day.